Hello and welcome to our COVID-19 update, where we'll be speaking to the Minister of Health, the Honorable Dr. Frank Anthony. Hello, Minister. Thank you for joining us today.
Well, thank you very much for having me on the program.
Okay, I know we have some limited time today because today is the first day of budget debates, but can we start with an update on the vaccines that are expected? We received some from Barbados, and I know we're supposed to receive some through the CARICOM African Union Pact. Am I correct?
Well, we are working on a number of strategies to get vaccines into Guyana. And I think in another week or so, we would be able to get far more vaccines coming into Guyana. We have been talking to the COVAX facility, and we are expecting now that the WHO has approved the AstraZeneca vaccine, that very shortly we would be able to get vaccines from COVAX. We have also been in conversations with some other countries, and those discussions are getting close to the end. So once we have concluded those talks, we'll start seeing vaccine coming out of those discussions and negotiations.
Okay. I know you would have mentioned by this month and we would see some more vaccines coming in. Is this set coming from COVAX?
We are expecting from a multiple sources, but at this point in time, because we haven't finalized all the arrangements, I don't want to prejudge what is going to happen. Definitely, we're expecting some from COVAX. We are expecting some from Sinopharm, and there are some other arrangements that once we conclude the discussion, we'll be able to say how many we're getting.
Okay, Minister, thank you for that. Now, I know it would have been like about a week since we've started vaccinating our frontline workers. Have we exhausted the first batch of vaccines yet?
Not yet, because what we've been trying to do as much as possible to identify those persons who are working directly with COVID patients, and to be able to give those persons the first preference. And so as of today, we have given out 1,852 vaccines to different persons. And we have done so in all regions excepting 8 and 9. But we have a team that is going into those communities during this week. So we'll be able to cover all the regions with the healthcare workers that are directly working with COVID patients. As you would know, that there had been some leakages of our vaccine, and we have an investigation that is ongoing to find out how it is that that person who came in and got a vaccine who is not a frontline worker. That's a total breach of the protocols, because the first set of people that we want to get vaccines are those who are most at risk. And therefore, we have to investigate and see why this breach occurred, and to make sure that we correct for it so that no future breaches like this would ever occur again.
Okay. Minister, you would have mentioned it would have been 1,800 plus persons would have been vaccinated, but from my estimation, we roughly had about 3,000 doses. So we're going to use all those doses, and from the next batch, these persons would be vaccinated?
Right. Because we are expecting more AstraZeneca vaccine, and because the time interval between the first and second dose, we can go up to 12 weeks. So we would get the AstraZeneca vaccine coming in, and so we'll be able to give those persons who got the first dose their second dose with the next batch that is coming.
Okay, thank you for that clarity, Minister. Now I have a question from the Guyana Chronicle. They're asking for an update on the police constable who would have died following after he allegedly took a chickenpox vaccine and some filaria tablets.
Yes, so we had a case where a young policeman got the varicella vaccine and then got a pneumococcal vaccine as well. So he got two vaccines. And then when he returned to the police station on the said day, our teams that were doing the filaria exercise went to that station and handed out pills to all the policemen and women that were on duty. And he took those pills as well. And then we understand that sometime thereafter he wasn't feeling well. And he ended up in the hospital and he subsequently died. So it's really unfortunate. There has been a post-mortem that was ordered for us to get a better understanding of what went on. That post-mortem was conducted on Friday. The preliminary information that I have is that the taking of the vaccines and the tablets are not the contributing factor to his death. And therefore, once I get the complete report, I'll be able to make a better, or at least to give more information. But what I understand is that the two things are not linked.
Okay. Thank you so much for that, Minister, and thank you for your time today. This has been DPI's COVID-19 update. For more information, visit our website, dpi.gov.gy, or our social media platforms.